Double frick. Still here, Jordan. Okay.
Alrighty, you respond to a 57-year-old male with chest pain.
Okay, 57-year-old male with chest pain. How far out are they?
They are...
Is this like Archer Highway sort of
They're
deal?
7 minutes away. They're
Okay.
just right over by Porter Park, a little more south, but... Yeah.
Sweet! Okay, so we show up, we get on scene. Initial assessment as we're coming in is, does my scene appear to be safe?
Yep.
Okay, I have my gloves on, making sure there's no barking dogs. If there are, then I'll have Jason kick them, because Jason's a good dog kicker. So we'll go on scene, looking for our patient. And where is our patient at?
So he is sitting in the garage, surrounded by his family, holding his chest.
Okay.
Yeah.
So as I approach, I'm going to introduce myself. Say I'm Josh. I'm with the ambulance as my partner. I'm going to be trying to get like an initial impression of him, basically like my sick or not sick, like your doorway impression, right? So what do I see? Is he like pale, sweaty?
So
what are we
he
kind of
is
looking like?
pale, diaphoretic.
Okay, that's just like our initial impression. Okay, so we're going to kind of try to have the family move out of the way a little bit so I can talk to him, see what's going on. So I'm going to ask him what happened.
Yeah, I was just mowing my lawn, and my chest has started to hurt, and it just hadn't stopped.
Okay, what's the pain like? What's it feel like?
10 out of 10, right in the center of my chest.
Okay.
Yeah.
How would you describe it?
It just hurts.
It just hurts. Okay, has something like this ever happened before?
No.
Okay, do you have any like diagnosed heart history?
I've had high blood pressure.
You've had high blood pressure. Do you take your medications for it?
Yes.
Okay. So we're gonna get initial set of vitals on him, with him as well. We're gonna give him faux baby aspirin, 324 milligrams.
Cool.
Throw that in
He's
there.
allergic to aspirin.
Is he? Oh, bag. I'm gonna, before I
Good
can
ask.
that, I'm gonna ask, are you allergic to this here aspirin?
No.
He's gonna say, no, okay, now take this.
Okay.
So he's gonna munch it up and he's gonna eat it. We're gonna get our initial set of vitals. What's he looking like?
Heart rate 120, SpO2 92 on room air. Blood pressure was 98 over 54.
98 over 54. Okay, so I'm gonna have my partner also get a 4 lead and a 12 lead on our individual as well. And so I'm gonna ask, so how long ago did this pain happen?
About 20 minutes ago.
About 20 minutes ago.
Hasn't stopped.
Okay. Does it travel anywhere in your body, or is it just straight right in the middle of your chest?
My chest.
Okay, sounds good. And so you're having any difficulty breathing, any shortness of breath?
I think just with the pain, just kind of makes it hard to breathe a little bit.
Okay, sounds good. Anything else going on with you right now? Any other complaints?
No.
Okay, any allergies?
No.
Is there like a list of medications that you're taking? And my partner's getting the 12 lead and stuff as we're doing this.
Yeah. My blood pressure medication's inside. I don't remember what the name is.
Okay. So is that the only one?
Yeah.
Okay. And then you were just mowing your lawn when you had this happen?
Uh-huh.
Okay. And so we have, what's our 4 lead? Looks normal-ish.
4 lead is, first degree block.
Okay.
And you're noticing ST elevation in leads. V1, V2, V3.
V1, V2, and V3. And this is significant or remarkable elevation of
This
like
is
2 millimeters or
This
something
is
like that.
2.5 millimeters.
In 3 concurrent leads. And so I'm going to say, well, we are going to get going to Ermac. As long as nobody here tells me I can't do that. As long as you're okay with that, patient.
Yeah, let's go.
Okay. And so we're going to get him loaded up. And we're going to start running license sirens to Ermac. I'm going to get IV access because I want to give him some fluids because I want to give him nitro. But with his pressure, which is like Scotial, I don't think nitro is, you can't give it if you're below 100 systolic. And And so we need to pop that up just a little bit before we can give it to him. I'm also going to throw him like a liter nasal cannula just because he was a wee bit low. Also, once we get his pressures up a little bit more and we can give him the nitro, hopefully that when the chest pain starts going down. If not, then we can consider morphine or fentanyl. I'm also going to be calling Ermac early to let them know I'm bringing him a STEMI. I'm going to be transmitting that 12 lead. We're going to also be taking serial 12 leads as we go down the highway just to be tracking this thing.
Cool.
We're going to get all of our other information as well, so like name, date of birth, all that jazz.
Cool. All right. So you call Ermac. What are you gonna tell him?
So this is Josh with Madison Ambulance. I'm calling in a patient report and a STEMI alert. When you're ready.
Ready.
Ready. So I'm bringing you a 57-year-old male, sudden onset of chest pain while mowing the lawn. Upon EMS arrival, he's pale, diaphoretic. 12 leads showed elevation in V1, V2, V3 that I have sent over to you under name. I'll list off my current vitals and say we're like 20 minutes out. Any questions for me?
Nope.
Okay, we'll see you then.
Cool.
And we'll go on some pressures. Hopefully it came up with some fluid that we've given him. Hopefully his oxygen saturations have come up a little bit. Giving him 0.4 sublingual nitro if pressure's indicated. Also, before I gave you that, is there a chance you've been taking any erectile dysfunction medications?
I did take some.
Did you?
Yeah.
Okay, well then we aren't going to give you this. So instead, we can give you some fentanyl for the pain.
I took it like 4 days ago.
Took it 4 days ago? Well, in that case, load on. Just load them up. And so then we can give that, we'll keep watching his pressures, especially just since they were just a touch soft. And we can give some fentanyl for the pain as well. And if fentanyl doesn't do it, because sometimes I've noticed that sometimes fentanyl doesn't really hit the chest pain super hard. So if not, then we give him
The
some
nitro is
morphine.
good enough.
Okay, nitro's good enough for him. Cool. So we'll just keep monitoring, keep taking 12 leads, get there fast, take him in. Hopefully they'd let us go straight to cath. They're not going to because it's Ermac and they don't trust our scene calls.
They did on this one.
Oh, sick. Bunch of gangsters.
Mm-hmm.
Then we'll take him up there, we'll get our signature.
Cool.
Yeah.
Cool.
I guess also with that one,